So Derek Carr goes down hurt. We're hearing that it might be an AC. What is that? Not an ACL, but an AC. David Elias joins us now, an orthopedic surgeon with Orthola to help us. I know you've not seen Derek Carr. You don't know what his condition is, but generally speaking, what is AC? What is a shoulder separation, shoulder sprain? Talk us through all of that if you can, please.
Yeah, an AC sprain, it's a pretty common injury we see in football, usually caused from a direct impact. Either you fall on the shoulder, you get hit at the shoulder, or you can fall on an outstretched hand. It's a sprain or a tear of the ligament that connects the acromion to the clavicle, which is the collarbone. We call it a separation, not a dislocation. And with any injuries, they're graded based on how many of the ligaments are torn and the severity of the injury. So, grade 1 is a mild sprain, grade 2 a moderate sprain. You get into your grade 3, 4, 5, 6 sprains, and those are the more severe. And sometimes, usually you're talking about surgery, reconstruction, grade 4 and higher. Sometimes a grade 3 can be surgical. With Derek Carr, it's his throwing shoulder, so that complicates it a little bit more as far as return to play, depending on the grade.
So a separation is a sprain, or a sprain is a separation?
Yes, a separation is, they call it an AC separation or an AC sprain. Anytime you're spraining a ligament, you're tearing fibers of the ligament. And again, most sprains that you hear about, whether it be the knee, an MCL sprain, or the shoulder, like an AC sprain, we grade the injury, based on the severity of the separation or the damage to the ligaments or the separation of the joint.
The treatment for this I guess it depends on the grade, huh?
It does. They'll probably get, you diagnose it by an X-ray. That tells you're looking at the X-ray to see basically how high is the collarbone separated from the acromion. And that's usually what you use to grade it. Now, they'll get an MRI because less than, I'd say 20% of the time, you can get an associated injury, another injury, like a tear to the rotator cuff or labrum, which makes it more significant. But typically, a grade 1 and grade 2 is never surgical. Grade 3s depend on the separation and depend on the patient. And again, with him being his dominant throwing arm, that could change whether you treat something conservative or surgical. But as a surgeon, when we see an AC sprain, we prefer to treat these conservative because they do a lot better and they get back a lot quicker because, typically they're milder sprains.
Wait, say that again, Doc. You prefer what?
You prefer to treat it non-operatively.
Gotcha.
So, because the outcome is quicker, it's faster, the return to play is faster. When you have to reconstruct an AC joint, that's about a year recovery to come back. So what we don't want to hear is that this is a grade 4 sprain that requires surgery. They know the grade right now, and of course I know nothing about it, but
right.
they've taken an X-ray. Typically, you can tell the grade of the separation by an X-ray. The MRI will be ordered looking for other injuries that may have occurred, which happen less than probably 20% of the time. So
you're talking about labrum,
nothing else happened.
Labrum or things like that.
Rotator cuff. Yeah.
So what kind of non-surgical treatment would somebody with an AC sprain of a lower grade non-surgical be looking at?
So if it's a grade 1 sprain, which are probably the more common, the grade 1 or 2 sprains, we just put them in a sling, let things calm down, and then get them into therapy pretty quick, get them moving pretty quick, and back to doing their sporting activity. Typically, if it's a grade 1 sprain, parents or coaches want to know how long is my player out, and I typically, if I'm just looking at averages, I tell patients grade 1 sprain, 2 weeks out, grade 2 sprains, maybe 4 weeks out, and a grade 3 sprain that we treat non-surgically, probably 6 weeks out. Now, with him, what makes it a little bit harder is his position requires him to throw. So a baseball pitcher or an overhead athlete or, a quarterback, it may be a little bit longer than what I just said, just because of the nature of what they do.
And on the other side of it, he is a professional athlete in excellent shape. I guess that helps a little bit, or not, or does it mean that the more the muscles are defined, the worse they can get hurt or something? I'm not an orthopedist doctor. I'm sorry.
It'll make the recovery quicker, being in shape for him, and easier. But I mean, it won't change how they treat or how careful they are with him. They'll make sure that he is throwing relatively pain-free and has all his strength back before they attempt to let him go back.
When it's gone, is it gone, or is this something that could haunt somebody for the rest of the season?
No, it shouldn't haunt him, but if you have a lower grade sprain, you can almost feel a little bump on your shoulder from the collarbone is basically raised up. And so if someone returns to play in the same season, they'll pad it just so he doesn't take another hit to it. But, I guess unless he has another injury, he's not risk. That would be the only risk of taking a grade 1 injury to a grade 4 injury if he sustains another direct impact. So typically when people return to play, they're ready, and we don't typically see them have a problem or come back with a worse injury that from the prior one.
So an AC they knew immediately. I know they took him to the hospital. I don't know if Green Bay has X-ray facilities or not. I thought they had him at every NFL facility. MRI would determine the other thing, whether it's a torn rotator cuff as well as a labrum. And, Doctor, I know you don't know anything about Derek Carr's case, but if it's the most minor, from your experience, for somebody that would have the most minor separation and playing quarterback, the quickest they could get back on the field would be?
If it truly is a low-grade AC sprain, I would say 2 to 4 weeks.